Hello, and thank you for attending the 2022 SAFER Summit. Please welcome your MC for the event, Tony Militello.
All of you that left the break at the beginning of the break have now returned for this next session. Again, an incredible session, the first one, and that level of engagement, level of insights will continue to be bestowed upon us for the rest of the day and again into tomorrow. The next speaker I'd like to introduce is Malcolm Glenn. Malcolm is a writer, speaker, organizational consultant, and public policy and communication specialist. He serves as a senior advisor to Mediarite and the health equity advisor for the Health Action Alliance. Malcolm has spent his career building partnerships between corporations, nonprofits, and governments, and telling the stories of impact of that work. He's the founder and CEO of MG Equity Consulting, an advisory firm that helps organizations embed equity in their internal and external facing work. Previously, he was the head of global policy for accessibility and underserved communities at Uber Technologies, where he led Uber's efforts to make the platform more accessible for historically marginalized groups. A native of Denver, Colorado, Malcolm graduated from Harvard College with a bachelor's degree in history, where he was the president of the Harvard Crimson, the nation's oldest continuously published daily college newspaper. Now, I'd like to introduce to you Malcolm and the topic DEI and health equity throughout the pandemic presentation, which is certainly an above-the-fold headline.
Well, it is really great to be here. My name is Malcolm Glenn, and I'm a senior advisor to the Health Action Alliance, Equity Consulting, which helps organizations embed principles of equity in everything they do, internally and externally. And I've had the pleasure of working with the Health Action Alliance since its inception, all the way back in February of 2021. And I'm super excited to join the National Safety Council's SAFER Summit today. Thank you all for the opportunity to share a little bit more about our work and what we've done over the course of the pandemic and where we're going and how we've tried to prioritize health equity in our past, present, and future efforts. So the Health Action Alliance was founded by the Ad Council, the CDC Foundation, the De Beaumont Foundation, the Robert Wood Johnson Foundation, and of course, the National Safety Council in partnership with our team at Mediarite. Thank you, as always, to our founding partners. And again, thanks to NSC for the opportunity to share our work today. In case you're not aware of HAA's work, the Health Action Alliance is a coalition of business, communications, and public health organizations that started initially to help accelerate the response to COVID-19 and strengthen acceptance of COVID-19 vaccines. But the Alliance has now evolved, and we're now focused on all of those efforts, as well as rebuilding public health and accelerating our public health response to all sorts of health issues during and beyond the pandemic. We provide companies large and small with free resources, training, and events that help them deliver trusted, fact-based health communications to employees. Since our founding in February 2021, we've helped hundreds of businesses implement COVID-19 vaccination policies that prioritize safety and health equity, as well as respond to other important public health imperatives. And you can see just a small selection of the organizations with whom we work on your screen right now. So in my role, I help lead a series of efforts, from workshops to town hall events, and creating resources that make sure that businesses are taking into account the impact on underserved communities when they're making their plan. And so today I'm going to share a little bit about what the Health Action Alliance is doing in terms of focusing on diversity, equity, and inclusion, both throughout the pandemic, first in our effort to try to get as many Americans vaccinated as possible, and then how we've pivoted to start to respond to some of the things that are occurring in the aftermath of what we've all dealt with over the last 2.5 years. And what a time it has been over that experience. It goes without saying, but the pandemic has truly been a devastating experience for all of us. The numbers are a bit unclear with so many people testing positive on rapid at-home tests. But as of mid-November, the CDC reported that almost 100 million people have tested positive for COVID-19 in the US. Well over 1 million Americans have died as a result of COVID, making this by far the deadliest pandemic in the history of this country. The cost has been unprecedented in terms of the impact on people's physical health, their finances, as well as their mental health. And we'll talk a little bit more about that last point a bit later today. But thankfully, we're in a much better place than at this point in the pandemic compared to where we were, say, in the beginning, spring 2020. We've produced, as you all know, multiple safe and effective vaccines in record time. These vaccines are all remarkably effective in preventing the worst COVID outcomes. And we now have these new variant-specific boosters. I got mine in September very easily just by going to my pharmacy's website, intended to prevent additional challenges as we head into the winter. But one of the challenges that we find ourselves in is that while we have these remarkably effective tools against COVID, far too many people still aren't protected. As you can see on screen, we have a lot of progress that we can be proud of. 69% of US adults are fully vaccinated in their initial series, meaning they have 2 shots of the Moderna or Pfizer vaccine, or 1 shot of the J&J one. But just 11% of people in the US have received their Omicron-specific booster. We'd love to see those numbers go up. And so the question we ask ourselves is, what's the explanation for why those numbers aren't even higher than where they are today? And among the answers we've returned to throughout the pandemic is, we got to lean into employers, helping them share trusted, targeted, and inclusive messages to employees from all different backgrounds with all sorts of different perspectives. And this is at the core of why the Health Action Alliance exists. The notion that we can actually utilize making workplaces healthier in order to make communities safer and stronger for everyone. And so the business community has been a major point of focus for us in terms of getting numbers like these to a higher point. But you may be asking, why the business community? Well, a big part of the reason is that the business community is the American institution where there's the most trust in our society today. Now, over the last few years, trust has declined in most institutions, particularly government and media. But that's been the opposite for business. Trust is actually growing. And in the latest Edelman Trust Barometer released earlier this year, 77% of respondents said that they trust their employer more than any other institution. And in another poll, 73% of Americans said that they want to work for a company that protects its employees during a pandemic. So for us, we saw this as a great example where the incentives were universally aligned for businesses to do all that they could to get those vaccination numbers up. And it would also affirm the trust that folks have in them. And it would attract employees who want to work at a place like that. And so the challenge we faced throughout the course of the pandemic, over the course of most of the last 2 years, was kind of twofold. How do we equip employers, as we know they're especially trusted, how do we equip them to most effectively communicate around the importance of staying safe during the pandemic, with a particular emphasis on vaccines? And how do we make sure that businesses are doing everything they can to make sure that these tools were available and accessible to not just some of their employees, but to everyone? So that's what we've spent so much of the Health Action Alliance existence especially focused on. Because while now we're much closer to parity in terms of the number of people who were vaccinated against COVID-19, that wasn't the case for most of the vaccine rollout. It might seem like a lifetime ago, but things were particularly stark in those early stages of the vaccine rollout, about a year and a half ago, back in the spring of 2021. So back then, when vaccines were still becoming available, but before there was vaccine-resistant variants that came to be widespread, about 63% of Americans were vaccinated. You can see some of those numbers on screen from back in April of 2021. But lots of people were still on the fence about whether they were still going to get their shots. And unfortunately, a large proportion of those folks hailed from historically excluded communities. So for us, converting that movable middle that you see on screen was not just a nice to have, but it was an imperative. It was about making sure that Black and Brown Americans who disproportionately been dying from COVID weren't also the ones continuing to go unvaccinated, thereby continuing to make deaths so much worse for Black and Brown folks. And it was important for us to understand not just the what, but the why. And as it turned out, many of those Black and Brown Americans who weren't getting vaccinated were Not doing so, not because of fears or hesitancy, even though there is a very real, very significant history of discrimination in healthcare in this country, but instead, a lot of those folks weren't getting vaccinated because of another challenge: lack of access to vaccine. So this map shows the lack of easy access to vaccination sites for people of color in East Baton Rouge Parish in Louisiana from early in the vaccine rollout back in February 2021. And you'll see that vaccine sites mapped here are small circles located mostly in white neighborhoods, not the areas where rates of infection, hospitalization, and death were highest at the time. And while access to vaccines did improve in the months that followed, getting to an especially better place in the summer of 2021, many people, including particularly people of color, they didn't forget about the inequities that defined the start of this pandemic. And so what we always tell folks is that it's not enough to build towards equitable access. But even starting with inequitable access, that seemed to depress the belief that people had that they would be able to get access to vaccines. And whether or not that was true or not, that was the perception that they had. And of course, as we know, in many cases, that was in fact the truth. And so lots of companies and organizations did all sorts of work to try to make clear that access was becoming more equitable over time. But we paid with tens of thousands of lives because of how vaccine sites across this country were so disproportionately focused on whiter neighborhoods, so long after the vaccines were authorized by the FDA. Now, there were companies that jumped into action at the very start. Companies like Lyft and my former employer, Uber, and others, they partnered to step up to help address access gaps, particularly when they were especially prevalent in those early months, by providing free rides to vaccine sites. And over time, accessibility became less of an issue. And it was the combined work of the on-the-ground efforts, employers hosting on-site vaccination clinics, offering paid time off to employees, and making vaccination information available in multiple languages, in addition to targeted, culturally sensitive communications that really helped make the vaccine rollout as equitable as possible over time. Because the Health Action Alliance is made up of so many talented communicators, I wanted to share just a bit about how we helped companies communicate to specific populations around the most important COVID prevention effort. So there are a few things that we kept in mind as we helped companies communicate with workers in general, and then tell you how that played into some of our specific culturally resonant messages. So generally speaking, we relied on simple, straightforward messages. Things like, we want to create the safest possible workplace and a healthier community. Or vaccines are safe and effective. Nearly everyone who is hospitalized or dying from COVID-19 is unvaccinated. And messages like, hey, this isn't about forcing you to do anything. This is about protecting the safety of our workers. Providing new information to an unvaccinated population and framing it to share that they couldn't have known this information previously, that was a way to allow them to change their minds about vaccination. Additionally, we encouraged employers to anticipate questions and leaned into those simple and straightforward messages. So for example, someone might ask an employer, hey, are you sure it's legal to require employees to get vaccinated? And that employer might respond with something like, hey, yes, absolutely. You know, federal law actually requires employers to protect their workers from workplace hazards. This isn't about mandating vaccines. It's about protecting the safety of our workers. And we encouraged employees at companies to be real, to be yourself, and to lead with empathy as they were communicating with their own colleagues. That meant things like acknowledging the challenges of the past 2.5 years and thanking your colleagues for all they've done during this really, really difficult time. It meant sharing personal stories about why the vaccine is important to you. The one I would often share was, I was actually a part of the Moderna trial. So I got vaccinated. I didn't realize it at the time, back in September of 2020. And so it was my own desire to help get us back to a world where we could do the things that we loved that encouraged me to take a little bit of a risk and, share my body with the trial in order to get us back to the things that are important to us. That's not everyone's story, but that was one that was really important for me to share that helped get people to feel a little bit more comfortable with the idea of getting vaccinated. And it was also important to make sure that when you were communicating with folks in your organization, that you felt comfortable with what you were going to say. And at the end of the day, just speaking from the heart. So to bring that all together, this was our suggested approach. Start with a roadmap, not a script. Listen more than you talk and acknowledge that it's okay to have questions. It's key to respond to misinformation with a truth sandwich that starts and ends with the reality of the situation. And as always, if folks were really stuck and they still had questions, we always encouraged employers to tell their workforce to talk to their personal doctor. Here's some example messages that we used throughout the pandemic. These vaccines are undergoing the most intensive safety monitoring in US history. Medical experts have been working on this technology for 30 years. Clinical trials began over a year ago with more participants than most other vaccines. The speed of the vaccine's development was a result of cutting red tape and bureaucracy, not cutting corners or bypassing any safety precautions. COVID-19 hospitalizations and death have been higher per population in small towns versus cities, in rural areas versus urban ones, for populations of color versus white ones. Fortunately, the vaccines are nearly 100% effective at decreasing the chance of hospitalization and death due to COVID-19. And they're available to everyone free of charge to help protect your family, friends, and our community. We talked about the need to help local businesses keep workers safe and to keep our economy open. We talked about how getting vaccinated can help you protect yourself and others from getting sick. We always pulled together for the benefit of our community. And we recognized, hey, you might not be worried yourself about getting COVID, but get vaccinated to protect your neighbors, your coworkers, and visitors to your community. Let's show the rest of the country how we take care of our own. So those were some of the messages that we leaned into. And you can see some high-level guidance as to what that approach looked like on your screen right now. But we also knew that we couldn't issue standard messages that would work for every group. We saw the data that everyone else saw throughout the pandemic around the way in which COVID was affecting and killing many more Americans from certain groups than it was Americans from others. So what we did is we put together specific messaging guides for various groups. And I want to share a little bit about each of those set of messages right now. So we were really intent on making sure that employers had what they needed to truly consider the diversity of their employees and their customer base. So with communicating with any group, we always started with the fact. The vaccines have been studied in clinical trials with large and diverse groups of people of various ages, gender identities, races, and ethnicities, as well as those with different medical conditions. Then it became important for us to consider the specific concerns that certain people might have. So when it came to Black Americans, we talked about how they represented about 10% of participants in the trials for the first two COVID-19 vaccines. The vaccines were free to everyone, regardless of your insurance status, and all those sorts of things. But in addition to the resources that we prepared, we also directed folks to trusted resources already out there, including the Center for Black Health and Equity and American Lung Association's joint specific report on COVID called Power and Opportunity: Information for Protecting Our Bodies and Our Communities. It's a fascinating report. And there's one note that I think was especially remarkable in how we encouraged folks to communicate. And let me quote. It is a little known fact that African Americans have progressed our country toward nationwide immunization since the early days. Most notably, a West African slave known as Onesimus was responsible for introducing the concept of inoculation to the US in 1716. When smallpox was ravaging the city of Boston and the world, this person shared a practice from sub-Saharan Africa that could prevent the spread of disease. He called it an operation, which had given him something of the smallpox and would forever preserve him from it. The operation involved rubbing a little bit of pus from an infected person into the broken skin of a healthy person. Introducing a small amount of the infection produced an immune response and effectively inoculated most participants against smallpox. While this method was considered unethical by modern standards, the practice saved hundreds of lives and laid the foundation for the smallpox vaccine that followed 100 years ago. And so sharing stories like this, that in fact Black people, even during enslavement, were actually at the core, the foundation of early immunization efforts, that went a long way in helping disabuse people of some of their fears around vaccination today. But that wasn't all we did. We also shared with our audiences a joint effort between the Black Coalition Against COVID and the Kaiser Family Foundation called The Conversation Between Us About Us. It was a really popular video series that dispelled misinformation and provided accessible facts to help Black Americans get vaccinated. We shared a great set of resources that were updated throughout the pandemic from blackdoctor.org in partnership with the Black Coalition Against COVID. We were also able to work with the Morehouse School of Medicine, which put out a really good set of public service announcements, one of which I'll show you right now.
For nearing a year, the novel coronavirus has taken away our loved ones, co-workers, colleagues, friends, and family. It has taken out thousands of businesses and millions of jobs in its wake. But now there is something very real that you can do to fight back.
For me, for you, for us.
For me, for you, and for us.
It is for me, it's for you, it's for us.
Dr. Kismikia Corbett, a Black female virologist with the NIH, helped to develop the Moderna COVID-19 vaccine. So do your part. Roll up your sleeve and get vaccinated. And if it's not quite your time, consider participating in a clinical trial. For me, for you, for all of us, it matters.
This message from the Morehouse School of Medicine.
So that PSA was from January 2021, and again came from the Morehouse School of Medicine, and was just a showcase of how important it was to have the messengers be from the communities that employers were trying to influence. Didn't get everyone on board, but seeing people talk about why they got vaccinated from communities who were trusted made a really, really important difference. But we didn't just create specific messages for Black employees. We equipped businesses with messages for how to talk to Hispanic employees about getting vaccinated, noting that Hispanic Americans represented about 20% of participants in trials for those first two COVID-19 vaccines. And we reiterated that for employees who are immigrants or who have family members who are immigrants, the Department of Homeland Security committed to ensuring that every person who needs a vaccine can get one, no matter their immigration status. We also worked with federal agencies to make sure that we had the most up-to-date resources in as many languages as possible, and worked with translators to make sure that our info was accessible, no matter which language employees spoke. We worked alongside Unidos US to raise awareness for a Spanish language version of The Conversation, which I mentioned on the previous slide, called La Conversación. This was a video where Latinx doctors, nurses, and promotoras, which is the Spanish word for community health workers, provided facts and dispelled misinformation about COVID-19 vaccines. We also directed folks to some great resources from Salud America, particularly one called Juntos, We Can Stop COVID-19. And since last year, I've represented the Health Action Alliance on the Latinx COVID-19 Task Force, where we've given trainings, shared best practices, and talked about what we've learned about messages that land best with members of the Latinx community. We also had specific messages, in addition to our overarching ones, to help employers who are trying to communicate with their Asian American employees. And in this case, that meant directing people to the National Asian Pacific Center on Aging's helpline, which provides information on COVID-19 vaccines, assistance in finding nearby vaccine clinics, and getting appointments in English, but also languages like Japanese, Chinese, Tagalog, Vietnamese, Korean, and Spanish. We also shared info from the Asian and Pacific Islander Health Forum, which is a community library with a collection of Asian American, Native Hawaiian, and Pacific Islander in-language resources on COVID-19. Links to those resources were submitted by community members, leaders, and national and community-based organizations that are actively working to improve the health and well-being of folks from those communities. We received great COVID-19 resources in a hub from the Association of Asian Pacific Community Health Organizations, and we hosted our own workshops at the beginning of the vaccine rollout, where we talked about how companies can leverage their employee resource groups to get out info to communities who may be facing particular concerns or fears, which we know was the case, particularly as we saw the rise of anti-Asian hate crimes during the pandemic. But our equity efforts weren't strictly based on race. Our outreach was intended to reach all people who might be disproportionately impacted by the pandemic, including people with disabilities. I'm personally on the board of the World Institute on Disability, which is among the leading global disability inclusion and advocacy organizations. We put together a series of disability-specific resources that encompass what governments are responsible to do to help people with disabilities in the midst of disasters like a pandemic. We also shared broadly the great resources from the American Association on Health and Disability, as well as great tips from the Center for Inclusive Design and Innovation at Georgia Tech on how to communicate with people who use American Sign Language, or what to do if you're an ASL speaker yourself, particularly challenging in an era of masks and much more limited opportunities to lip read, as well as the great set of accessible resources dispelling rumors from the disability community about its impact on certain conditions. And this came from the Center for Dignity and Healthcare for People with Disabilities. We took every resource we could, vetted it to make sure that it was going to give trusted fact-based information, and we let those folks be the messengers to the communities about the importance of COVID-19 prevention. But it wasn't even just based on your demographics. We also focused not just on who you are, where you are. We saw many of the vaccine numbers continuing to lag over the course of the pandemic, particularly in rural communities. So we worked with a number of organizations to help close those gaps. We partnered with the Rural America Chamber of Commerce to create a vaccine checklist for rural employees, which was a set of simple steps to make it easier for folks to get vaccinated if issues of access or politics were perhaps more significant. We also partnered with the National Rural Health Association, as well as the COVID Collaborative and the Ad Council, to create a toolkit to help rural employees, small business owners, and public sector employees share vaccine facts. The Ad Council has, in particular, been a wonderful collaborator on all this work, as evidenced by a great rural community education toolkit that we've shared with folks who were interested. And we even hosted a National Rural Business Summit back in 2021, specifically focused on how to reach rural communities, with experts with lived experience chiming in on the most effective message. And so in sum, in addition to everything I've said thus far, I'll just end by saying that each of those examples was an indication of how we really tried throughout the pandemic to prioritize two things in all of our vaccine-related communication. The messages mattered for everyone. Having a roadmap, listening more than talking, acknowledging questions, that truth sandwich, and directing people to their doctors, that was key everywhere. But it didn't end there. And in doubt, encouraged employers to rely on those simple, straightforward messages, to anticipate those questions, and to be real, be yourself, and to lead with empathy. So those messages mattered. Who those messengers were mattered. And making sure that the messengers were tailored and culturally competent was key too. But the messages weren't enough. Community engagement was also paramount in achieving some semblance of equity in our vaccine communications campaign. We were aware enough to know we didn't have all the expertise. And we never stopped seeking out the expertise of trusted partners from the communities in question. And while we can't know exactly how big of an impact that made, I think it's fair to say that that helped us equip businesses with the tools that they needed to get a lot more people vaccinated against COVID-19. That said, just because we've reached a place of, let's say, equilibrium in the pandemic, we know there's a lot more work to do, and we're far from finished. And we find ourselves in the midst of a mental health crisis now, with billions of people who've yet to fully reckon with our collective trauma over the course of this really, really devastating pandemic. And so, the Health Action Alliance has spent the past few months really examining how we can turn our health equity focus to dealing with the pandemic's aftermath. And so, we've created a couple of resources with that in mind. The first is our Workplace Mental Health Playbook, which is a comprehensive introduction to workplace mental health with specific emphasis on how employers can create programs, equitably engage historically excluded communities in their workforce, and provide a support infrastructure for employees across all demographics. In addition to the playbook, we also have a communications toolkit to help company leaders normalize and socialize the importance of thoughtful mental health programs, particularly for folks in groups where there may be a little bit more of a stigma towards talking about your mental health. And you can find the playbook at healthaction.org/mental health. And in the past few weeks, we've also released a guide to building a mental health employee resource group, which is a condensed resource for helping businesses empower their employees to build a mental health ERG. We know employee resource groups are among the most scalable ways that employees with shared identities can push leadership to make change. And we think mental health is at the forefront of among the most significant changes that can really improve outcomes for folks from historically excluded communities. The link to find that guide is the same one as before, healthaction.org/mental health. And finally, we also created an employer guide to cultivating belonging in the workplace, which is a comprehensive introduction to workplace belonging, along with, again, some sample communications around how leaders can create a culture of belonging where employees genuinely feel comfortable bringing their full selves to work. We know from tons of research that when folks feel like they belong, it increases their physical, emotional, and mental health. So we hope that it can be used in conjunction with our other resources to help employees really begin to transform their workplaces with equity in mind. Just like all the other ones, you can find this resource at healthaction.org/mental health. Listen, these resources all exist in pursuit of a singular goal at the Health Action Alliance. And that goal is to create a stronger, healthier future for everyone in America. And so with that, I'll just say thank you. Appreciate you spending time with me today. Appreciate the opportunity that the National Safety Council has given us to share a little bit more about our work. And I'll also just note, you can find not just all of the resources I've talked about today, but so many others that we didn't even have time to touch on, all at healthaction.org. And with that, I just want to say thank you again for joining. I hope you found our conversation today helpful. Again, my name is Malcolm Glenn. I'm a senior advisor to the Health Action Alliance, and I really appreciate you all tuning in today. If you're interested in partnering, learning more, or figuring out ways to collaborate, feel free to reach out at hello@healthaction.org. So thanks, everyone, and thank you again to the National Safety Council for giving us this opportunity to share more about our work. Thank you so much.
Thank you, Malcolm. What a great presentation. And you really hit the nail on the head for this morning's two topics, and certainly the one that you just completed there. We are far from finished. We are far from finished, both in terms of the pandemic and the things that we were talking about in the aftermath, but also in this two-day summit. We are far from over. But again, we've heard great things from Malcolm over the last, half hour or so. Really a good thread from the initial one that John moderated this morning, right? Talking about trust, talking about, it stands to reason that Malcolm and his work has really been focused around communication and getting, again, specific communication, specific messages, and really making sure that those are targeted communications to the individuals that we're trying to reach, right? Making sure that we have access for people of all abilities, people for all representations, to make sure that we are, again, having a safer and healthier workplace and any place for everyone in America. Again, it's certainly some of the things that really resonated with me. And from his early days as the president of the Harvard Crimson, right, it stands to reason, again, that he would focus his life's work on communication and making sure that the message is being communicated, not just so much in a way that's clear to the sender, but it's clear to the recipient, so that the recipient can take those necessary actions that they need to make sure that they are keeping themselves and their loved ones safe and out of harm's way. So we're going to head to a quick break. But here's my truth sandwich before we do that. Truth is, had 2 great presentations this morning. Truth is, we're going to have 2 great presentations later today. But in the middle of those second 2 presentations, we're not going to have a break. So load up on the things that you need over the next 10 minutes or so for this break. And we'll welcome you back in about 10 minutes at the bottom of the hour to hear from Richard Fairfax and some updates about OSHA and the safer OSHA and the COVID-19 pandemic. So again, look forward to hearing you and seeing you back in about 10 minutes.